CARE-FREE SNORE STOPPER. Snoring Dentist. Anti-snoring appliance. Snoring Dentist. Self-diagnosis method for snoring. 1. If snoring damages not only patient's life but also family's life and various people sleeping near you. 2. If people who are sleeping next to each other may be unhappy or wake up because they are noisy. 3. If people were sleeping with you at same room used to go to another room when you waked up. 4. If it became more than 3 years since couples started sleeping at separating room or place. 5. If the mouth, throat, and airway is dry, discomfort and stuffy snoring. 6. If you go to pee more than 2 to 3 times waked up during the sleeping. 7. If singer, speaker and priest who had snored last night would have experienced troublesome at their activity. Self-diagnosis method for sleep apnea. 1. If I am always tired and sleepy like an anorexia. 2. If my head is not clear all the time, and my headache comes. 3. If I often forget where I put things like forgetfulness because I have not focused. 4. If I do not memorize well because I have a low memory. 5. If grades are often poor for students, the energy is diminished for adults men. 6. If even if you sleep a lot, you do not want to wake up as if you did not sleep well. 7. If I wake up often and do not sleep well without knowing that I am sleeping, and I feel tired even if I wake up in the morning. 8. If most patient wakes up more than 2 to 3 times one night to go pee. Are you sure to stop snoring and sleep apnea permanently? Yes. Still, many people don't know that dentists fix snoring and sleep apnea. Now, treatment of snoring and sleep apnea in dentistry is a global, world, trend. There are several treatment methods for snoring and sleep apnea. What treatment you are going to take is your choice. 1. Surgical therapy. A. Uvulopalato-pharyngoplasty, UPPP. B. Oral implant. C. Laser-associated uvulopalatoplasty, LAUP. D. Pharyngeal flap operation. 2. Non-surgical therapy. A. CPAP. B. Oral appliance. C. Wearing a vest or watch. D. Medications. E. Nasal spray or drops. F. Changes of sleeping posture. Non-surgical therapy. 1. CPAP. 2. Medications. 1. Theophylline for heart disease. 2. Progestational agent obesity hypoventilation. 3. Opiate antagonist and nicotine to improve oxygen. 4. Thyroxine for hypothyroid patient. 5. Acetazolamide for central sleep apnea. 6. Serotonin for obesity and insulin res. 7. Protriptyline. 8. Spray and drops. 3. Oral appliances. So many anti-snoring and sleep apnea appliance. The best choice is CARE-FREE Snore Stopper. CARE-FREE Snore Stopper is one of the dental oral appliances for snoring and sleep apnea treatment. The results are guaranteed. First day assessment work completed. Patented by Korean government. No matter how severe snoring and sleep apnea is, CARE-FREE Snore Stopper can stop right away. Never say never. If it doesn't work, money back guarantee. Clinical cases where snoring was completely cured after using CARE-FREE Snore Stopper. Registration for CARE-FREE Snore Stopper. 1. Only 2 to 3 visits. 2. Intraoral examination will be done. 3. Panorama X-ray will be taken. 4. Impression for upper and lower full mouth will be taken. 5. Movement of jaw forward and backward. 6. Registration by gorge gauge device. 7. Bite registration will be taken with red wax. 8. It will take 10 to 14 days to receive the completed CARE-FREE Snore Stopper. www.snorestopper.ca teethc@gmail.com. Treatment for snoring and sleep apnea, with the CARE-FREE Snore Stopper dental appliance is done only in Dr. Hong's dental office. There are no ready-made appliances. You must visit our office in person to get your own personal, customized oral appliance. I cannot guarantee any other oral appliance. Only some dentists who have been trained by Dr. Hong are able to treat snoring and sleep apnea patients with CARE-FREE Snore Stopper. MK Dental Office. 7010, Warden Avenue. Unit 3. Markham, Ontario. L3R, 5Y3. Telephone. 905-940-8788. 647-992-3345. www.snorestopper.ca. Email, teethtxy@gmail.com.